So here we are.
What pleasure seeing you, Russ. How you doing? It's so nice.
Well, better for seeing you.
This
And
time it worked, right?
so today, I would like you to enlighten our IG Live audience about therapeutic biofeedback. I'm sure people have heard of biofeedback, but I'm not sure they know what it means. But what is the difference of therapeutic biofeedback, which you have been good enough to do with me, to great help to me personally, but tell the audience.
Okay, so what is biofeedback? If you think about it, anything we do in the world to learn, to master a skill, you need information that you're doing it right. If you play basketball and you're trying to get the ball in the hoop, then you may miss. The visual information that you miss tells you, oops, I did something. You don't always know what you're doing, but then you keep correcting. And in that correction, you master a skill. In the same way, our bodies are continually, producing signals or is reacting to things. And we're totally unaware in many cases that we are reacting. So let's say I sit at the computer, I'm working, and then by the end of the day, I have neck and shoulder tightness. Now, by the end of the day, I may know that my shoulders feel tight. However, I am unaware in the initial stages, especially, that I may be raising my shoulders and that I'm unaware of it. So how can you become aware of that? Well, there are many technologies for this. So it's not the technology per se, but it's really figuring out a way, how can you monitor what you do and how can you display that to the person, guide the person, and then train the person to do it differently. So using the example of the shoulders for a moment, I can put a small sensor on my trapezius. That's the shoulder muscle that may let me go like this. And then what happens is that as I'm starting to work at the computer, the tension may be going up. I'm unaware of it. I really don't notice it. But the computer or my device would tell me, hey, your shoulder is slightly going up. It may give me an alarm signal that would remind me to say, oops, what is going on? So then it increases my awareness and it gives me the option to intervene. So then I can drop my shoulders. I'm using that as an example. I can give other ones. For example,
Let me jump in. Let me tell you a story about my father. My father loved basketball. He actually played professional basketball, but that was much later. The point of the story is my father was very nearsighted, so he couldn't see the basket, but he could see his feet. He knew where his feet were on the court. And his big brother had the key to the YMCA so that he could practice for hours at a time, just throwing the ball towards the hoop. And once in a while, it went in. And that was enough reinforcement to keep him at it.
Yes, and it's not just reinforcement, it's really telling him whatever you did just before is the right thing to do.
Exactly. Whereas we are conditioned to know the wrong thing to do.
Correct.
So we have to unlearn.
So I would say there are two parts. One is awareness. Two is unlearning. And sometimes it means learning a new skill. The major premise, I would say, for biofeedback, which makes it really a mind, body, emotion system, a social system, is that it intrinsically shows and demonstrates that mind, emotion changes body. And when you change body, it changes mind and emotions.
So the mind and body are connected.
Yes. They're not even just...
We've had several hundred years of that mistake. The mind and body are always connected.
Yes. And what makes biofeedback so elegant, sometimes we call it almost like a Trojan horse approach, because many people think it's only in my body. And when you have a problem and you feel the pain, it's in your body, no disagreement. However, it may be that unknowingly you are getting upset, you get stressed, and in the process of stress, you tighten your muscles or your heart rate goes up. You're not yet aware of that. And then that is the trigger to start leading to the potential pathology. And some can become very serious. Let me maybe give an example of the shoulder for one of my students. It just happened last week. It was just so nice. We're teaching a class with teaching people how to relax, or really how to monitor the muscle tension in the shoulder, as I said. Well, she has both a texting thumb problem, it's achy as they work on the cell phone, and she has headaches and is taking medication. She took this little device home, she put it on her shoulders and noticed time and time again that her shoulders went up, and they stayed up. The key is, it isn't a problem that your shoulders go up. It is when it stays up for a long time, then it's a problem. And because then the muscles cannot regenerate in that sense, so the tissue.
Well,
she then interrupted that. She learned to do it. She dropped her medication and is headache free. It's just it's both remarkable. We see this so often. So biofeedback then can both monitor. It's one of the nicest tools I know if you think of evidence-based medicine.
Yes, evidence-based medicine is in. Evidence-based medicine is a coming thing. And we're talking about evidence-based medicine. Personalized evidence-based medicine.
Yes. Let me give I'll give two more examples for biofeedback, because you can use any physiological system in your body, because we're all interconnected. We know that if our toe hurts, how we walk changes, even our thoughts changes. And so I'm not going to talk about all the systems, but just a few specific ones. Let me look, for example, at breathing. And the reason I look at that is because in some sense, we have such a big increase in anxiety with people. Also, even depression since the COVID pandemic. Part of it is that people, they may be not socially connected. There are many reasons. Another part is that their breathing pattern tends to change. When I sit at the computer, I don't know it, but I'm sitting, I'm slouched forward. When I slouch forward, without knowing this, I breathe higher in my chest. I have no idea about that. My abdomen doesn't move anymore, and I'm unaware. Now with biofeedback or coaching, you can put sensors on the chest or the abdomen, and you can show how the breathing pattern is going. So now if you have a person who may have anxiety, for example, and it's never everybody, it's really always personalized, as you pointed out so well, then you see that the person often breathes very quickly and shallowly. They're not aware of it.
And what is the point of that? If you breathe shallowly, do you exchange oxygen and carbon dioxide?
The key is when you breathe shallowly, you tend to exchange, you get oxygen in, but you tend to blow off too much carbon dioxide generally. And that means that your pH goes up. It means you tend to have vasoconstriction on the periphery, you probably have colder hands, and you increase the risk of feeling anxious. And also your coronary arteries will constrict in time. So, we are a system, people forget. Right. And just by changing your breathing pattern, by breathing lower, and then practicing that a lot, you all of a sudden find, yes, you may still be somewhat nervous, because there are many situations that should trigger something, but now you develop mastery. Instead of escalating into panic, you can now interrupt. This was vividly demonstrated. About 3 weeks ago, I was in Italy at a biofeedback conference, the Biofeedback Federation of Europe. And one of the participants was a woman from Poland, and she has panic attacks. Well, we monitored her. It was clear. She had no idea. Truly, that was the most, here, that her breathing rate was like 20, very high, only basically in her chest. And she felt perfectly normal, quote.
Well, that was normal for her.
Yes. Whatever we have is normal if we habituate it. Then we taught her how to breathe lower by we put a strain gauge around her stomach. You could put your hands on. There are many strategies to give you feedback. She learned to do that. And luckily, she did not have abdominal surgery before, which would have inhibited her abdomen from expanding easily. She didn't mind that her stomach could get bigger when she inhaled. It's almost like breathing like a little baby, where you have this big Buddha belly going, or when your dog lies on its side and you see the stomach going up and down. She did that. And to her own surprise, when she did this more effortlessly, which is hard to do, to think about. So you let the air go out, the abdominal wall almost goes in a little bit, the lower ribs go in a little bit, and then You almost just paused and let the air flow in by itself. Her stomach got bigger. All of a sudden, she noted she felt more relaxed, although she felt perfectly relaxed before. Then we taught her how to purposely try to breathe in this abnormal way to trigger her own panic attack. Initially, she was very scared. I don't want to do that. But she started to do that. She could feel the feeling, and then like a switch, flip it back, breathe lower. And it gave her massive mastery. It's just so impressive when you see this happening. Now she knows that she has some control. It doesn't mean this is the only thing. There's an interaction of diet, social events. The hardest part for people is transferring the skill to daily life. It's no different than if you go to the temple or to the church and you learn all about how to be caring with human beings, and then you go outside and you scream and yell at people or fight for a parking place. The key is, how do you transfer that skill you learn of compassion to during the day to other activities? This is no different in biofeedback. If you learn slower breathing, it's nice if you can do it for 20 minutes. It's great. You'll feel a little better. However, the moment you shift, oh my God, at that moment, observe it, interrupt it. And I'm so impressed when people do that.
Now, do you distinguish what's called vipassana, which is a Sanskrit term for mindfulness? The practices of vipassana sound to me very much like what you're teaching in therapeutic biofeedback.
I would say I'm in total agreement. But I often think about mindfulness and many of these techniques which are now hot. It is old wine in a new bottle label. And if you go to biofeedback, or even earlier, the work of progressive relaxation, where you learn to tighten your muscles and let them go by Edmund Jacobson, or later the German techniques of autogenic training, where you learn to somehow, in a way, to warm your hands and heaviness and heart rate, that they may ask the following. They all ask you to be present, to just observe without judgment, not let your brain run away with other thoughts. Come back, be present in the task. That's the core, in a sense, of a type, you almost say mindfulness, or being just present at this moment. What makes biofeedback so remarkable, when you're monitoring, and I see this time and time again, if you monitor, for example, skin conductance, the sweatiness of your palm, or your heart rate, or the blood vessel diameter, which you can do if you monitor, for example, your pulse, and you can look at the height of that signal, then what you see as you're going along and you're working with somebody, therapeutically, it looks very good. And all of a sudden, you see a change. It may go up and down. And what is so interesting, you can then say, what just happened? And in almost all cases, the person realizes, oops, I thought of this stressful event, or I thought of somebody lovingness. It depends how the signal goes. Now they realize that the thought, emotion affects body. And this is nothing new. All spiritual traditions have said this, be careful of what you think. Every thought affects, every thought and emotion affects your body. And every system and every change in your body affects your thoughts and emotions. So you can work it in both ways.
We can become aware of this. You're saying that we don't have to be at the mercy of this. We can become aware of these signals and use them helpfully.
Correct.
I recommend that people get up from their computer 5 minutes, an hour, and stretch and hydrate, for obvious reasons, but just breaking those patterns. Sitting for 6 or 8 hours is like smoking 2 packs a day. So that's a terrible thing to do to yourself.
Yeah, and the way I often think about it is an evolutionary perspective. Ask yourself again, when we were more hunting and gatherers, what were we doing? Well, we were sitting in front of the fire or whatever, or in a cave. Then we walked. We ran for a short distance. Then we paused. We regenerated. We looked at the far distance to see danger or friends. Then we looked nearby, but we almost never were static. And now what we're doing, like in front of the computer or most modern technological jobs, we may just sit in one place. That is a formula for disaster. And we are unaware. I'll use the example of sitting. That's maybe not big. and we are unaware that we may be dysfunctional. As friends of mine say, if you get the perfect ergonomic setup, that means you have the right chair, you sit at the right angles technically. It gives you the opportunity to sit correctly. It doesn't mean you do. You may still be slouching like this, and you don't know it. The biofeedback, if you do that, even on slouching, which is some of the work we have done very recently, is very simple. You put a device in someone's neck, or you can use the computer camera to identify the slouching. So we'll tell you online as we're working right now that I would be slouching. It monitors the posture, and the moment you slouch, it would vibrate in this case. You know, when my students did that as a study, they had no idea initially that they were slouching till much later, or somebody took a picture of them, or my mother told me, hey, Eric, sit up, right? We know both of that. But what was interesting is they then observed, what did they observe? One, they slouched when they were tired. Well, that's obvious. They slouched when they were having to look at the screen like this. They didn't know that. That means you need to solve the ergonomics. They slouched because they couldn't see well. They needed better glasses, or they couldn't hear well. They slouched because they had depressive thoughts and felt hopeless for a moment. Oh, I have to finish that exam or whatever. And then it gave them the potential, the opportunity to sit up, to change. And you don't always have to sit up. Just like you said, wiggle around, do something different. And even for the listeners right now, just for a moment, just wiggle around, move, or take a big breath, and then it makes no difference almost. I mean, I'm less persuaded. Yes, there are appropriate exercises, but often it's the alternation of movement that's even more important. But what is most important, when the students did that, and we're just having another study in process, they report a significant increase in their health status. They had less neck and shoulder pain. They were less exhausted. And what we're now seeing is that they are more able to concentrate and keep focused. Because when I start drifting and I put myself in a sleepy position, I have more easy access to my past memories of depression. We don't know that, but it's the case. Then if I sit more up, and we notice, the world is looking up. I feel more optimistic slightly. I'm so impressed by that change. It isn't like it's a giant change, you don't go from but they noted that they were more productive. They could stay more alert in the studying, and we live in a world where so many of us have lost our attention and we just drift away. So I had a student, in fact, who had kind of an ADHD issue, or when she did this, for those time periods when she was really up, for that moment, she could just be present. And that to me, and the biofeedback then was that tool by which the person could become aware. And then with a coach, sometimes by yourself, sometimes in very systematic training, you can learn to change your physiology, which really, but in the act of changing physiology, you're changing your brain. They're not separate. That's what the error people make. Our bodies change it. Just if anyone, go outside, take a walk in nature, look around. I'll bet you in most cases, when you come back, you feel better. We did this last night in our class because we had a lecture about nature. I had a guest who does that kind of work. She took the students outside for just 15, 20 minutes, looking at the plants. They came back. My gosh, I told her, I don't know what you did, but the students all had a smile on their face. And normally they come in class and they go, oh my.
Right.
And they're just on their cell phone. That means you get ready for learning. Now, to finish the therapeutic parts of biofeedback, it's a very giant range. You can use biofeedback for almost clinical assessment, which is very useful. That can be very helpful. What is it? And then you can train the person. So it's almost a diagnostic tool. You can use it for a training tool and keeping data. Let me give an example of this, okay? What I'd like you to do as you're sitting on your chair is, maybe you want to stand up. Just stand up for a moment. It's probably easier to do. You stand up. I know if you won't be able to see me standing up. Maybe I'll have to change my camera. Maybe I can do it this way. I stand up. Let your arms hang along the side of the body. Now bring your start abducting your right arm just a ½ inch outward. So my right arm would go like this, except the hand would only go about no more than an inch away from my thigh. Okay? And let it come back. Do it one more time. Just an inch away from you. Where do you feel the tension? Do you notice any? Not really, probably. Now bring your left hand over your shoulder, over the deltoid, the anterior deltoid. Now on the side of the arm, on this where you feel the deltoid, let the hand go all the way around as much as possible. Let it float on the muscle. And now start pulling your hand away from your thigh. And you can feel the muscle tightening. Okay, I'll let you go. Sit. Why did they do that exercise? Because before, when you first brought your arm slightly out, you were not aware that these muscles tightened. When you felt it, now that's your feedback device. Now for this, it's not important, but that's the concept. The equipment would amplify these subtle changes. And at the same time, in this simple exercise, if I kept my arm out all the time, I can hold it out. How long can you hold it out? Well, a couple of minutes. It would depend how much I pay you. And then you would get achy. But if I bring the arm up a little bit and bring it back, let it relax, bring it up, relax, I can do this for hours during the day. So here's a simple example of muscle feedback. But you can also look at heart rate, which is where you can bring balance, and many other patterns.
Delightful, wonderful. Can change a life in moments, but aggregated moments. And I'm glad you pointed out that you can have a coach, you can have someone externally guiding you, that's helpful, but you can also have an internal coach.
Correct.
And that's okay. It depends on what suits the individual at that particular time.
And it depends on the reasons what you're trying to do with it. I mean, the applicational range for biofeedback as a tool is remarkable. A very useful tool, as we still talk about muscle for a moment, is for incontinence, especially for males after a prostate surgery, removal, prostatectomy. Then often they are leaky. For women, often as they get older after childbirth, and then when they get much older, they tend to leak. That is often called stress incontinence. That is not psychological stress. It means you apply too much pressure on the bladder and the sphincter muscles aren't strong enough, or the person doesn't know it and they leak. You can monitor that with biofeedback, monitoring the muscles of the pelvic floor. For men, you would rectal sensor. For women, it's a vaginal sensor. They can now see that when they are trying to tighten the muscles of the pelvic floor, they're not doing it correctly. They can learn. And in about 4 to 6 sessions, you have an 80% success rate.
Wow.
It is one that, and if you think about it, it makes sense because it's the process of learned disuse. If you give birth and you have a tearing, it hurts. Without knowing, you learn not to tighten those muscles. You have learned to keep those relaxed in a way. Now, over many years, that gets worse, and then you become leaky. But you still have that initial programming, so this can reactivate it. It doesn't solve it for everybody. This is one of the best pieces. If I do whole other area of application, for example, this is the work for kids who have, their belly aches, GI distress, really. And we have a number of, especially in junior high school, we have these kids who really have massive ache in their abdomen. They are frustration for their parents because the parents love their child. They want to do it. They can't solve it. They go to their physician. The physician can't solve it. They go to the gastroenterologist. They get a GI series. Nothing works. In the work by Dick Gevirtz and others, they show that these children, and there's a criteria for it, if they're very conscientious, that's what you need, almost perfectionistic, conscientious, want to do super well, then you have an 80% success rate in about 7 sessions by just teaching these children heart rate variability. You really are teaching to breathe lower and slower, because if you're anxious in performance. You tend to tighten your abdomen. You don't know it. You hold it tight to protect yourself against the saber-toothed tiger, metaphorically, the fight-flight response. You breathe shallowly, but when your stomach is held tight and you hold this posture, your body basically, you're saying, why should I digest food? Why should I heal myself when I'm becoming someone else's lunch? So it's evoking these early fight-flight responses. And if you live that way in the world, you're going to have digestive abdominal pain. Now you teach these young children to change that. In 8 sessions, almost all of them get better. You can now do a diagnostic this way. If the child has these discomfort and they're not conscientious, not perfectionistic, don't give a damn about doing well, you send them back to the gastroenterologist, because then you know there's something really physiologically wrong. It becomes a diagnostic separation.
Or they feel hopeless rather than helpful.
Yes.
So, in sum, therapeutic biofeedback has very wide application.
Correct.
To improving health and well-being, to being both preventive and proactive and predictive and personal.
Correct. It is totally personal. By definition.
That's a very important piece, because when I'm feeling poorly, it's all about me. And I think many people, when they're feeling poorly, they want to know what to do that will help them help themselves, but they don't know what to do.
That's right.
And so they lurch from one thing to another for a few days this way and a few days that way, when in fact they should, as you say, slow down, breathe more deeply, allow their mind and body to work together rather than work apart, and be more self-aware.
Yes, but the challenge of awareness is, if you only teach awareness, you often feel worse. Paradoxically, you need awareness and skill mastery to know where you're going, and we live in a larger context. If just as if you have pain, even if you can't do anything about it, but if you have hope for the future, you see optimism, you do much better. If you don't have hope, you feel worse. And so it's interactive of many of our social network just as much.
And as you say, when we look at a fixed distance rather than far and near, we tend to be constricted. We tend to be restricted.
Yes.
And with restriction comes problems, which we don't associate. We don't see the cause and effect. But you're helping us see those causes and effects.
That is, see, to me, it's the biofeedback. It's really a mirror of yourself. The coach, the therapist, whoever it may be, can help you identify the patterns, because we may not know that. They can look at the individual difference, and you can ask, what would it be when you are healthy? Then you can train yourself to be healthy. The distinction of biofeedback is, it is learning skills, not pills. Skills, not pills. Very well said. And it doesn't mean, it really works in great conjunction with other things. It's clear that when I think of my students, for many of them, their diet is disastrous. I hate to say it. And their lifestyle, half the time you want to embed it, what I'll call, into grandfather therapy. That means, go to bed somewhat at the same time, wake up at the same time, eat healthy meals, whether you eat 2 meals a day or 3 meals a day, I couldn't care less what it is.
But eat whole foods. Don't eat processed foods. Don't eat packaged goods. You got it. It is, we teach students this in a holistic health class at San Francisco State, in a holistic health program. It's every semester we have an improvement in the students' self-rating of benefits, more than 70 to 80%. Wow. And they range anywhere from no longer having headaches to feeling, we have a 73% reduction in anxiety on the average, and it's in some sense, you look at it and say, these are the skills you should be teaching all children at the beginning. But it's also, we need to be in a culture that supports that. And when you go, just as when you go to the supermarket and all the sugar is available in the front at the counter, that doesn't support health. Absolutely. And an example of what you're talking about is Pitney Bowes. Pitney Bowes is a company that was run by a guy named Critelli. And all he did was he moved the candy bars and the sugar to the side. And he put cucumbers and carrots and broccoli at the checkout counter. That dramatically reduced their total cost of healthcare.
Yes, it makes perfect sense to me.
Well, we should all be doing what you're talking about nationally. The United States Preventive Medicine Task Force just recommended screening all children for anxiety. Well, I think more children do have anxiety, but we don't know what to do about it. So if we just screen for it, we will identify more of the problem.
Yeah, what we want to do in those cases, have children go outside, get in the sunlight with vitamin D. Instead of saying it, do more body movement. Have them look up, because when you look down, you have more. In our research, you can see the brain change literally. That's the work I did, the work with my colleague Yimei Ling. You see that it just becomes more difficult in this down position to even think of positive thoughts. And then what we do is we sit only in front of screens, and we now know that myopia has significantly increased during the pandemic. Now, young children's myopia is much more harmful even than for older people, because the eye, you're really changing the physiology of the eye massively right away. And we know that now 1/3 of all US children are pre-diabetic. And that is, it is so, I mean, I go like this. That is like they're getting ready to become type 2 diabetic. Type 2 diabetics for children is much worse than type 2 diabetics for adults, because you're changing the whole physiology. So the prognosis of that epidemic coming up, I think, is just terrifying in many ways. And yet it's totally controllable, totally avoidable. That is in most cases. It's always most cases.
Oh, look, perfection cannot be the opposite of good enough. What
That's
we're
right.
talking about is practical, practicable, and ready now. We don't need more studies, although more studies are always good.
I know. It's like, well, and then going back, I think that, almost every medical center, almost every office, anybody who works with human beings ought to be doing some form of biofeedback with it as a mastery model, because it really shows how you can change your body, and it offers skill mastery, and it blends so nicely with physical therapy. It blends so nicely even with the meditative practices. You can see your thoughts are changing your body. Now you believe it. You can teach people mastery models. I mean, most of us are breathing high up in their chest without knowing, because they're puffed up or whatever. By shifting that, we can bring the body back to a balanced, sympathetic, parasympathetic state.
We do this in our companies. We
Great.
do exactly what you're describing in our companies, and we do it for a very practical reason. People are happier, people are
Yes.
more productive, people get sick less, they feel better more. Therefore, they interact with other human beings in a more appropriate, supportive, um, cooperative way. So we do this because I believe in it. We do this because, as you know, I practice what you
You
preach.
preach.
But more importantly, I do it for very practical business reasons.
I happen to agree. It's like if the person feels more safe inside almost, or a little more peaceful, less at the edge of anxiety, less feeling, quote, hangry is a common feeling, then they become less reactive. You want people to be proactive and plan. And what we have shown most interesting using the monitoring of people, that in body posture, if you collapse and you pull yourself in like this, it is harder, and you're looking down, and now you ask the person to do a mental task like math, subtract the number 7 from 100, that would be 93, 86. Do this mentally. You do it in this collapsed position, defensive position, versus in this more open, upright position. Then the person has a much harder time doing the math in the collapsed position. What you're really doing is, when you put yourself in a defensive position, You can no longer think, I mean, it's exaggerating, of the past or the future. You just deal with only immediate survival. And when you deal only with immediate survival, then we do these nasty responses. And that breaks the communication. On the other hand, if I can pause, take a breath, and that takes training to do it. It's role rehearsal, it's practice, and then I can breathe. I've learned how to breathe. I take a pause back. All of a sudden I get more clarity. And there's nothing new said about this. Before you get upset, take 10 breaths, right? Or 3 breaths. But the data is there. And then we need to implement it. And the biofeedback suggests ways to show how your body reacts. It offers feedback to do it a way you want to do it. And then the outcomes are remarkable. And I'm impressed time and time again, whether you have asthma, whether you have epilepsy. There's very good data now that you can train the brain waves of a person with epilepsy to change those the same way you would do with the muscle, and they can inhibit seizures. Now, my gosh, instead of taking lifelong medication, which may have negative side effects, here is a strategy where you literally can start changing the brain activity. But we change our brain activity when we move our arms or legs just as much. We've changed our brain activity when we breathe differently. So there are many pathways, and I'm impressed equally for people who have gastrointestinal distress, whether they have acid reflux, whether they have irritable bowel. And it doesn't mean it's the only thing. It may be that it's the human biome that needs to be addressed. Diet needs to be addressed. And yet your other patterns are interactive with this. So take charge where you have control. Do things which you empower yourself by doing it, which optimizes your health.
Magnificent. We will hopefully have another time to talk more about this, but thank you for the guidance. Thank you for the practical information. Thank you for helping so many, many people and for documenting it as well.
Well, Russ, thanks so much. And some of these, if people are interested, by the way, we do a blog, we have published a number of articles, but we also do a blog called Pepper Perspective. That's with 1P in the middle, Pepper Perspective. And if you, in the search box, put the topic in there, you'll probably see a blog that's usually based upon a scientific article, and often interviews also with some of our students or clients describing what they did with the data.
Magnificent.
Thanks so much.
Thank you. Be well.
Well, what a pleasure to talk to you.
Technology is our friend.
I know. This time it worked, right?
This time it worked.
You changed the model.
Right. But we had fun doing it.
Oh, it's fun. It was nice seeing you. So what are you doing? Well, you're keeping very busy.
I'm doing what you know, but I'm also doing a book about Bhante Dharmawara, the monk, that had such an influence on me.
Interesting.
So that book will be out next year. We have a book this year on how to thrive in the 21st century, and
Yes.
we have a book on bones, joints, and muscles, how to have healthy muscles, bones, and joints for life. I co-authored that with Susan Brown and Jay Srimani and my sister Marcy.
Great.
So we're as you are, we're doing our best to spread the word of the possible, not the impossible.
Yeah, I think that it's really what you want to. You want to have an impossible goal in the long distance, but the focus is on the possibilities. The analogies in sports. You want to have a goal, potentially, I want to be in the Olympics or whatever. However, you don't spend much time focusing on that. You focus on the small steps you need to do to improve your performance. And if you do that step by step, you'll get there.
What my daughter says is she sets for herself an impossible goal.
Yes.
But she's satisfied if she can get closer to it. Whereas if she sets a low goal, if she sets something that's easy to accomplish, she has no motivation to do it.
No, I can understand.
I think that's wonderful.
And the other part is we don't, the limits of our experience are the limits of our beliefs.
Yes.
Our beliefs
we want to expand our experience to change our beliefs.
Yeah, and basically you want to also change your beliefs, so you have to you don't put your own limitations on. So often what I see is that we limit our own possibilities because our parents said you can't do this, or we've adopted that perspective, or because the culture, I've adapted some cultural perspectives that, some groups can't do this, they're not very skilled at that. We don't know what we are capable of doing. What we can do is we can keep working at the edge where we keep improving and develop mastery.
Amen. Thank you.
Okay, thanks so much, Russ.